Idaho Matters podcast is brought to you by St. Luke's On-Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on-demand care for common ailments, such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org.
Hi, I'm George Prentice. Will you join me in kicking off the Sun Valley Film Festival with a movie lovers event sponsored by Boise State Public Radio and The New Yorker? Last year's event was a huge success. 2 of the movies we showcased went on to get Oscar nominations. This year, you'll meet filmmakers and see some great movies. Wednesday, December 3rd, you can get all the details at boisestatepublicradio.org.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. Norovirus is on the rise. There's an increase in AIDS in eastern Idaho, and raw milk is making some people sick in the Gem State. It's Wednesday, which means it's time for our Dr. Roundtable with Dr. David Pate. And remember, you can still email us questions this hour. Just go to idahomatters@boisestate.edu. So joining us today, of course, is Dr. David Pate, former CEO of St. Luke's Health System and author of the book, Preparing for the Next Global Outbreak. Hi, Dr. Pate.
Hi, Gemma.
So, Dr. Pate, I want to begin today with the FDA coming out and blaming 10 children's deaths on the COVID vaccine. And now they want to make it, frankly, tougher for children to get vaccines. So, Dr. Pate, what do we know and not know about the FDA's internal analysis claiming that 10 pediatric deaths were linked to COVID vaccines?
Well, frankly, we know almost nothing. Despite the repeated pledge for radical transparency, the FDA has not shown us their analysis, not given us any specific information other than that they did some kind of analysis on 96 deaths in children that occurred between 2021 and 24. And they determined that 10 of these deaths were after vaccination, but they don't tell us, well, was it like 10 minutes after vaccination or, 10 months later? And they say it's either after or because of the vaccine. Well, that tells us almost nothing. Are these 96 deaths of any cause? I think that if they had specific cases, you wouldn't say you did some kind of statistical analysis. You would say, we identified these cases. I don't think that's what they did. I think they did some kind of working with data and came to this. But, we have to be very cautious. This particular person that was overseeing the analysis has been for a long time has been very hostile to vaccines. He has an agenda, and we have seen some of these so-called statistical analysis before, and they're not scientific. They're not. There's all kinds of holes in it, and so I just don't know what we're supposed to take away from this, since they will not show us the data, the analysis, or more information. Now, on the other hand, what did happen is that was completely overshadowed by the FDA's announcements was the release of one of the largest studies of nearly 14 million children that in fact showed that children were much less at risk of all kinds of different complications if they got vaccinated versus if they got COVID. So I think we have to be skeptical, but I think they're not being transparent. And when they're not being transparent with us and not showing us the data and the analysis, that makes me think it's because they know that we could see the holes in it and it wouldn't hold up.
So, Dr. Pate, how do medical experts typically determine whether a vaccine actually caused an adverse event, and what could constitute credible evidence then?
Yeah, so we have a number of ways of doing this. The first thing is that we have the studies, the initial
Hmm.
studies done, where we look to see did you have one arm that got the vaccine, one arm of the trial that got the vaccine, you have another arm of the trial that did not, and you compare them and you look to see are there different rates of occurrences of things. And so that is the first red flag when they say, oh, well, there were 10 deaths that occurred after or because of the vaccine. Well, they're not telling us the comparison. Well, how many deaths were there from COVID? And for example, from 20, they used a 3 year period. I don't have the same data yet. I haven't had time to get it, but they used 3 years, 21 to 24. But if you just look from 2020 to 22, there were almost 1,600 deaths from COVID in children.
Mm.
So the first thing is we always use a comparator. What this group that got the vaccine versus this group didn't, or you do it by monitoring our vaccine safety reporting systems, and you look to see is the rate of occurrence being reported uh, higher than would be expected. And so you'll remember, Gemma, that with the Johnson and Johnson vaccine that came out early and caused some deaths, I think we picked it up after 4 deaths. I mean, our
Mm.
the way that we have monitoring, we can pick these things up very quickly. Here we are in 2025, and all of a sudden, the FDA is just now telling us, "Oh, we might have identified 10 deaths." No, we would. Why did we not see these things in real time? I think it's just not credible. So we can check these, and then when children or anybody does have adverse effects, we investigate those and see is what was the timing compared to when they got the vaccine. We have none of that information from the FDA in these cases. Was the child otherwise healthy, and what was the nature of it? In this case, they're talking about deaths. Well, but death from what? And so there's just so much information that's missing, so much more that we do when we're serious about looking for adverse effects and all, and we just don't have it here.
So, Dr. Pate, the FDA has said that, I mean, they want to make it more difficult. I mean, they didn't say difficult, but basically to put more restrictions in place when it comes to the availability of vaccines, in particular for children. So, what could stricter approval requirements mean for the availability of routine childhood vaccines and disease protection in the long run? So, not just access to the COVID vaccine, but access to, childhood vaccines.
Well, they haven't told us exactly, but they've given us some clues. So, first of all, for example, they have said that for some vaccines, they're not going to take evidence of the development of antibodies as a marker of it working. They want to see a reduction in the disease. Well, first of all, we do a lot of that already. What I fear, what they really mean, is they are going to be looking for, uh, you know, a higher standard of not even preventing even mild disease. Because we saw this problem with COVID. The COVID vaccines did a wonderful job of preventing you from getting severe disease, but they would constantly pick at the fact, yeah, but it didn't keep us from getting COVID. Well, uh, first of all, that wasn't completely true. But second of all, wait a second, let's just back up. If you could prevent me from getting severe COVID or getting severe flu, why would that not be a benefit? And so I'm afraid of what standard they're going to impose. And frankly, we have used for many decades markers of antibody production as a very good surrogate an indicator of effectiveness of vaccines. We have not had a problem. They're doing their best to manufacture a problem now. And so, what that means is it's going to make it harder for the vaccines to get approved, longer for them to get the vaccines approved, and more expensive, which means it's going to discourage vaccine development.
Mm.
And there might be people that think, well, that's just fine with them. But what are we going to do with the next pandemic? What are we going to do if, for example, as I said, the next pandemic could look very different from COVID. If you were not impressed with COVID, just wait, because there are other organisms that could cause far worse problems than what we dealt with COVID. In fact, one that we're kind of watching and a little concerned that we're not paying very much attention to this, the bird flu. And
Hmm.
that could be a much more serious illness in children. And so, do we want to have a pandemic where what we saw happening with older folks with COVID is now having to with kids, and we're going to say, well, but we're going to do a really long, extra burdenous trials before we could approve a vaccine in the kids? I mean, just remember back to what it was like at the end of 2020, especially for people that were worried about their parents, their grandparents, and they wanting to get vaccines, and how anxious they were to get those vaccines. That's how it would be for parents worried about their kids. And yet now what they want to do is put in more hurdles, more barriers to childhood vaccines. And that's concerning.
So, Dr. Pate, I want to turn now to the flu season. We've talked about this a bit on the show. Can you start out by telling us about this new flu strain? It's called what? Subclade K, I believe, if I'm saying it right.
Right. That's right. That's right. And so what is happening is, of course, every year we have an influenza epidemic. It's our flu
Hmm.
season. And but what is different this year is in most years, the type of influenza virus we're dealing with is generally some type of an H1N1 virus, is what we would call it, and those are names for the two major proteins of the flu virus. So that's usually our usual suspect. And but what happened is that we started seeing, as the flu season progressed in the southern hemisphere, and then as it moved into the northern hemisphere, that what we were seeing emerge was an H3N2 type. Now, why that is important is, first of all, that virus typically produces a more severe illness than the one that we normally deal with every year. And number two, that because this is a different strain, we haven't seen this one in 3 years. So
Mm.
people are going to have less protection to it. They're going to be more susceptible to it. It causes a more severe illness. And then what you were mentioning, the subclade K, that refers to the fact that even for an H3N2 virus, this virus has gone through at least 7 mutations that I know of since this summer. And so it's becoming even less and less recognizable by our bodies. The good news is that the influenza vaccine will help protect you from severe illness. And what this virus may be particularly troublesome for is children and adolescents, because they're
Hmm.
unlikely to have any kind of meaningful immunity to it. And in fact, what we saw is that in China, in Japan, in the UK, in Australia, also, we saw that their flu season, it dragged out, and it put a lot more kids in the hospital than is typical. So this is a really good year for you to get the flu vaccine. It's not too late. And to get your kids vaccinated, remember, influenza outbreaks typically start in schools with school age children. As we are in the holidays and approaching the December holidays, the schools are going to be out. Those kids are going to be getting together with families, and we're going to see this spread a lot. So, getting a flu shot now would be well advised.
And Dr. Pate, I think it's fair to say that every year we see deaths from the flu. So I think
Yes.
people need to be aware of that.
That's right. But I think what it, also to point out is that last year we had a record number of child deaths, child and adolescent
Mm.
deaths from influenza for any non-pandemic flu year. So our last flu pandemic was 2009, and we had one death less than occurred in that 2009 pandemic.
Wow.
And I think there's a concern, given that this is a more severe kind of strain, that we could have a similarly bad year. We won't know, of course, until we go through it, but I think we should, if there's ever a time to protect yourself from flu, that would be now. Also, just remind listeners of a discussion you and I had about a month ago, that there are certain vaccines that will reduce the risk of acquiring dementia later in life, and flu
Hmm.
vaccine is among those. And we know that in the year after influenza, you are at more risk for heart attack and strokes, and there are other kind of complications. So there's other reasons to get the flu vaccine, just than you want to avoid death.
So, Dr. Pate, can you explain what the South Central Public Health District is seeing with HIV and AIDS cases this year, and why are these increases concerning?
Yeah, so this was a bit of a surprise to me when I saw the notice out of South Central Public Health District. Now, that, for listeners that don't know, that is the public health district in Idaho that covers Blaine, Camas, Kasha, Gooding, Jerome, Lincoln, Minidoka, and Twin Falls counties. Um, and what they reported is that they had seen a concerning increase in HIV cases and in what they are referring to as HIV-3, which probably most listeners don't know. That what you would know it by is AIDS. So
Mm.
HIV is when somebody is infected with the virus, but may not necessarily have any signs or symptoms. HIV-3 or AIDS is when somebody is infected, and after generally what appears to be about an 8 to 10 year course, the virus has weakened the immune system. We can measure it in the blood level of certain immune cells, and they typically develop what we call opportunistic infections. In other words, infections that wouldn't cause a problem for people that are immunologically healthy, but do occur infections when their system is weakened. So, what to give a sense of proportion, what they reported is that last year they had identified 5 cases of HIV infection, and this year already it's 15, so triple.
Mm.
What they said is last year with HIV-3 or AIDS, they had 1 case. This year, they've already identified 9. So, and I was taken aback because these are small numbers, but they are very big increases, and I do think it means something. I'm not sure what it means, but I don't think this is just a random fluke. What we've been seeing for the past number of years is a decline overall from a national standpoint in HIV and AIDS cases. So this is concerning, and it's not occurring uniformly across the country. And I think there is some concern that perhaps in a lot of states that have taken away their Medicaid expansion, as we have, it might mean that people that were HIV positive, that what we can do is basically we can make that a chronic disease by identifying it and then putting them on antiviral drugs. But those drugs are expensive. And so if they lose their Medicaid, then they are not likely to be able to pay for the drugs. So they would rely on public sources of the medications. But of course, the administration has also decreased funding for public health and for these kinds of things. So that is an immediate concern I have. I think
Mhm.
that also with the fact that we've really been taking away funding from public health districts, and we have been trying to make sure that their guidance and education is politically correct, and that we're not addressing some of these sensitive subjects. I'm afraid that a lot of the education is not getting out there, and people may have misconceptions about AIDS. There may be people who believe that well, you don't have to worry about it unless you're homosexual, and of
Mhm.
course that's not true. In fact, in the latest data that where this is broken down that I have, which is from 2022, heterosexual, meaning people that have sexual activity with the opposite sex, that accounted for almost a quarter of the new HIV infections. And another statistic that kind of gives me a little bit of a clue is that if you looked at those new cases in heterosexual men, they only accounted for 7%. If you looked in heterosexual women, they accounted for double, 15%. So why would that be? Because this is a process that would typically infect both. And what I think it means is that women may be getting better screening. Perhaps they're because they go in for gynecological checkups, whereas
Mhm.
men may not be paying attention to this. And with HIV infection, you may not have any symptoms. So if you are if you have risky behavior or you have multiple sexual partners, even if they're heterosexual, you need to be getting tested. You need to be screened for a number of different sexually transmitted illnesses. So I think it's something we got to watch. I don't know what the explanation is. I've given you a couple of possibilities, but we're going to have to watch this and see if this becomes a trend. And if so, that's very, very concerning.
And Dr. Pate, well, South Central District Health is offering free HIV testing on select dates this month. So, talk about why folks should take advantage of this early testing and why it's important.
Yeah, this is very important. And please don't avoid the testing because you think you're going to be stigmatized. First of all, the public health department does a fantastic job of this, a great job of protecting your anonymity and identity. So please get that testing. And the reason you want to do it is, first of all, as I said, if we identify that you have the infection, we have treatment that can prevent this from turning into AIDS. If you do not get that treatment, that's the eventual outcome. You will get that, and then it is a whole different ball game. The second
Mhm.
thing is because you would not know that you're infected because early on you typically don't have symptoms, you risk now presenting a danger to others. And you might end up infecting somebody else. So you need to know and take precautions. So please do take advantage of that kind of testing. Here, it's great because it's free, but also it's great because they will protect your identity. You don't need to worry about being stigmatized. You're actually showing care and compassion for other people by getting tested because you certainly don't want to infect other people.
So I want to turn now, Dr. Pate, to another issue, and that is that we're seeing an increase in illnesses linked to raw milk here in Idaho. So, what kinds of infections are being reported, and how serious can they be?
So, the typical infections that we see with raw milk are bacterial ones. and it's due to contamination of the teats when milking or the milking devices, and so that is why we pasteurize milk, is because there's almost always bacteria in there, and the pasteurization process is just a very quick temporary heating of the milk, but at a level that would kill the bacteria, so we don't have to worry about it. That's all that pasteurization is. We're not otherwise altering the health benefits of milk. It doesn't not putting anything new into milk. We're just killing those bacteria. And the ones that we worry about, which are the ones that have been reported here in Idaho, are Campylobacter, which is it can be very serious in the elderly, the very young, children under 5, those with weakened immune systems are particularly vulnerable, and pregnant women. And it can even cause serious problems like spontaneous abortion. And then another bacteria, but we've seen a lot fewer cases of this compared to the Campylobacter, and that's Shigella toxin producing E. coli. And what happens is that if the milk is not pasteurized and these bacteria are present, then when you're drinking the milk, you're drinking in the bacteria. These are both bacteria that get into and infect your gut. So you will get nausea, vomiting, diarrhea. You could even get bloody diarrhea, and you typically can get, fever and just feel miserable, get dehydrated. And that's one of the reasons why this can be particularly dangerous in young children. It can be very hard to keep them hydrated outside of the hospital.
So, Dr. Pate, what symptoms then should people watch for if they've recently consumed raw milk, and when should they maybe get medical care?
Yeah. So the first thing I would say is there are people that have financial interests that are promoting so called health benefits from raw milk. And I just want to tell listeners that based on the current state of medical knowledge, there is no health benefit of raw milk over pasteurized milk. Milk does have nutritional value, it has health benefits. So it's not the fact that it's milk, it's the fact that there's no benefit of having it raw versus pasteurized. And having it raw brings these additional risks that we've just talked about. So the first thing is, if you are currently consuming raw milk or plan to, I would certainly urge you to at least be informed about the risks, if not defer from doing that. But second, as far as symptoms, typically the first things you're going to notice are upset stomach, maybe vomiting, probably diarrhea very soon thereafter, and perhaps fever. And if you've been drinking raw milk, then that's the point to get in touch with your doctor, because it signals you probably do have one of these bacteria, and we can treat those. The real concern, as I said, is if it's a young child under the age of 5 drinking the raw milk, or an older person drinking it, or somebody who's pregnant, or somebody who's immunocompromised. If you have any of those symptoms, you need to contact the doctor right away, because those patients are the ones that are most likely to have serious problems.
So, Dr. Pate, we should note that, raw milk is legal to sell in Idaho. And in fact, we have a listener, Jen, who sent us an email, and she said exactly that. Raw milk is legal to sell in Idaho. Raw milk is legal in Idaho, and it is sold in many places. So she goes on to say, so Dr. Pate, what should consumers know before deciding whether it's safe for their families? And I ask this because I think that if you are someone who has chosen to drink raw milk and have it in your home, you're probably going to keep doing that.
Right, and that's certainly your decision. We just want people to be informed. I would also note that cigarettes are sold in stores legally in Idaho and in all states, but that doesn't mean they are healthy. And I just want you it. If you choose to drink raw milk, fine, but know that that is being promoted by people that have significant financial interests in you consuming that. From a doctor standpoint, I'm just telling you, I can't think of a single reason to recommend raw milk. I would certainly recommend pasteurized milk, but I can't think of one reason to recommend a raw milk. If you are going to have consume raw milk, then please just be give it an extra thought if you're going to give it to your kid, or if you are pregnant, or if you're going to give it to somebody older. Please reconsider that choice. If you decide to still do it, then you really just have to be on guard for these symptoms and know that if they occur, it is for example, I do not worry about getting Campylobacter infection. And I don't really worry about getting Shigella toxin producing E. coli infection. And people that drink pasteurized milk don't. But if you're drinking raw milk, you do have to be worried about these, and they would require medical treatment. So know the symptoms, get in touch with your doctor, and make sure you make your doctor aware when you call them that you have been exposed to raw milk.
So we are seeing a rise in norovirus cases across the country with positivity rates nearly doubling over the last few months. So, Dr. Pate, what exactly is norovirus, and do we know why the cases are climbing so much?
Yeah, so as its name implies, it is a virus. It's a very hardy virus, meaning that it can be difficult to get it off of surfaces and so forth. One of the way that this virus is transmitted is it either contaminates food or it contaminates a surface that you touch, and then you either ingest the food or you put your hands to your mouth and you get the virus introduced that way. It causes typically a very rough gastroenteritis, of vomiting, diarrhea, those kind of things. Very likely to get dehydrated, and and the thing that's important to note is that the sanitizing gels are not real effective against it. So this is one where you want to be
Oh,
washing stuff with warm water, soap and water, if you're cleaning surfaces. And in fact, if anybody's infected in the house, you need to be cleaning the surfaces because this is very, very transmissible. As to why, we do typically see a surge in norovirus during the winter months
hmm.
when it gets cooler. So this is not unusual. We can see it at many other times of the year as well. But I think Alabama, Nebraska, Oklahoma, Texas, and Wyoming are having a rough go of it at the moment. We certainly could be seeing it soon. I think we have had some cases, but not as bad as some of these other states.
So, Dr. Pate, what should people, be doing then, or kind of what symptoms should people be watching out for? And is there a point where maybe they do seek medical care? Because I've had stomach virus before. I've gotten so dehydrated that I've landed in the ER just to get rehydrated.
Yeah, well, if you get the norovirus infection, you won't need me to tell you. You'll
Okay.
know you are darn sick, and so you'll know. The real key to this is that being aware that if you are around someone, so this is normally where we see it as outbreaks on cruise ships, where people are
Mm,
congregating together and using buffets. If you have someone in your household with it, then that's where you have to be very, very careful. The virus probably can be aerosolized by the toilet. So if you are trying to avoid it, you may even want to wear your mask when you're right around the person. But the big thing with norovirus is you're going to be just wanting to wipe everything down and really trying to prevent getting that exposure spread. Fortunately, there's no treatment needed. You don't need to be on, unlike the Campylobacter we talked about, you don't need to take antibiotics for
Hmm.
this. It'll go away. And mercifully, it usually goes away in a day or two. So it's just a day or two that you are going to regret mightily because you're so miserable.
Okay, so you definitely will know. With that said, Dr. Pate, we so appreciate you. Folks, remember, if you have public health questions for Dr. Pate, you send them to us. Give us an email, idahomatters@boisestate.edu, and we will see Dr. Pate next week. I'm Gemma Gaudette, and this is Idaho Matters.
How does AI even work? Where does creativity come from? What's the secret to living longer? TED Radio Hour explores the biggest questions with some of the world's greatest thinkers. They will surprise, challenge, and even change you. Listen to NPR's TED Radio Hour wherever you get your podcasts.